I'm Dr. Kelly. I'm one of the orthopedists at the GIKK firm. I've been here since 1985 doing adult reconstruction surgery of the hip and knee. First, you may wonder why I might have gone into orthopedics. I never really was planning on going into medicine until I got into college. But my father was probably a major influence for me. He was in charge of the orthopedic program at the Mayo Clinic in the 50s up until the 80s, and he built that program to what it is today. One of the things he suggested to me was that you should operate in a vacuum. And what that means is you should find an area of expertise that makes you really good at something that maybe everybody else isn't good at, because you develop a specialty that nobody else really does. And that'll add value to what you do. So with that, I chose to go into joint replacement of the hip and knee, but to subspecialize into partial knee replacement. But what it is, it's a real conservative surgery for the knee, giving you a lot of options to not do a full knee. So basically I try to do partial knee or a bicompartmental knee, and saving the ligaments and things that you have that aren't worn out yet. The first thing we talk about when I see you might be just you need to do some exercise. So I push a lot of exercise programs on my patients, trying to get them to the gym maybe 3 days a week to build strength in your muscles and get aerobic conditioning, because that's part of the treatment of arthritis and basically the beginning treatment. When we can't stay healthy and active, then we start to deteriorate, and that's where I come in with invasive procedures such as a cortisone shot or something like that. But I'm always pushing the exercise first, and even once we do the surgery, I'm pushing that afterwards. So we get a lifelong process of building strength and staying healthy. As far as who I am, I was raised in Rochester, Minnesota. That's the home of the Mayo Clinic, as you know, and moved here in 1970 for medical school at Creighton. And then I went away to Cleveland for my orthopedic training until 1984. Then I went back to the Mayo Clinic to do a fellowship in joint replacement, and then came here. I have my wife's from Omaha, and I have 6 kids, 3 girls and 3 boys, and they do lots of different stuff. They're all different. And they keep me busy, and a couple of grandchildren. I like to exercise. What I encourage my patients to do is exercise, so I also do it myself. And my big thing is circuit training to build strength in your muscles, because one of the things that I fear for my patients is as they get older, into their 80s, that they'll end up not being able to take care of themselves and having to go to a nursing home. So I'll try to get them started on an exercise program as soon as I see them, to make sure that they can stay active and not have to go to a nursing home. So I spend a lot of time getting my surgeries ready, my patients ready for a surgery, to make sure I've covered all the small details, that nothing's left out. I have a big interest in sleep apnea, and so I'm screening a lot of patients for that and doing some studies on that. So I think the 2 biggest things that probably just destroy our society as far as our health is undiagnosed sleep apnea and weakness. So I screen patients for that and get tests when they're necessary, and then I push the exercise and strengthening. So things I like to do, like my hobby would be circuit training, which I do 3 days a week to stay strong, so I can take care of my patients. And then sports, the only sports I really do are tennis, which I don't do much right now, but as soon as I get back into the game, I haven't really forgot how to do a drop shot or hit a smash serve.